In this video, I'm going to help you figure out whether your neck pain is coming from your neck or your nervous system. Because if you're focusing on the wrong thing, you can chase fixes for years, be doing everything right, and still be getting nowhere. Before you can move forward, you need to know what you're actually dealing with. And that's what this video is all about. Hi, I'm Ellen. I'm a chronic pain counselor with a background in physical therapy. I've worked with hundreds of people with neck pain, and I've had it myself for decades until I figured out what was actually driving it and found my way out of it. This video is not a diagnosis, and it does not replace medical advice. In fact, as you'll see, medical assessment is actually a prerequisite for this process. This video is going to specifically focus on neck pain because people with neck pain need answers, just like I did. But this approach can apply to many forms of chronic pain and illness, as it did for me with my chronic eczema. There are a few different names for the phenomenon that I'm going to talk about today. You may have heard it called mind-body syndrome or MBS. You may also hear it called neuroplastic pain or central nervous system sensitivity, CNSS. In this video, I'm going to be using the term CNSS or CNS. So what is CNS? Central nervous system sensitivity is when your nervous system gets stuck in high alert mode and produces pain and other symptoms as a protective response, even though there's no actual structural damage or danger. In the neck, this can show up as aching, tightness, headaches, jaw pain, tingling, numbness, shooting pain, or pain that spreads into the shoulders or up into the skull, and a whole bunch of other very fun symptoms. CNS can feel very severe. Even when there's no ongoing tissue damage, the pain is real. It's just being driven by a different mechanism than, say, a spinal fracture. What matters here is how you treat a structural issue like a spinal fracture versus CNS is very, very different. Now, we don't want to just assume that you have CNS. Before we rule it in, we need to do our due diligence and rule out structural causes first. I never want to miss a structural issue. I always keep in the back of my mind, is there anything here that suggests this could be an injury or a medical condition? So I'm going to walk you through the thinking process that I take myself and every single client that I work with through to help us make sure that we've covered all our bases. Whether I'm working with someone with chronic neck pain, lower back pain, eczema, pelvic pain, fibromyalgia, or anything else, I go through this process. Again, this is not a diagnosis. It's simply a way to help point you towards the most sensible direction to explore next. You can also use this process to help you decide whether working with someone like me makes sense for you, or whether it's better to keep exploring medical or structural options first. Let's get into it. So let's say you walk into my clinic with chronic neck pain. The first question you need to answer, and the first question I ask all of my clients, is, have you seen a doctor to rule out serious medical causes for your neck pain? Not everyone with neck pain automatically needs to see a doctor, but if you have any of the following symptoms, it's important to get a medical assessment first. And I wouldn't work with anyone who hadn't done this step if these symptoms were present. Symptoms include severe or progressive weakness, persistence or worsening of numbness, shooting or electric pain down the arm or into the head, severe or sudden thunderclap or ice pick headaches, eye pain or vision disturbances, fever or unexplained temperature changes, lumps or swollen lymph nodes, recent trauma like car accidents or a fall within the last 6 months especially, and especially if it hasn't been medically evaluated, or anything else that is severe, unusual, or suspicious. If you have any of these symptoms, but you've answered yes, your doctor has ruled out serious medical issues, move on to the next question. If you haven't seen a doctor, but you don't have any of these red flags, you can move on to the next question. If you haven't seen a doctor, but you do have any of these symptoms, please get them checked out by a doctor first. Come back to me when you have the all clear. Alrighty, question number 2. Have you had this neck pain for more than 3 months? 3 months is a commonly used time frame for distinguishing between acute pain and chronic pain. Neck pain that's been present for less than 3 months will often improve with time and appropriate care. But pain that continues beyond that point is less likely to be a simple give it time scenario. If you answered yes, you've had this pain longer than 3 months, move on to the next question. If no, it's been less than 3 months, you can still use calming, gentle nervous system tools, but it's reasonable to give it just a bit more time to allow it to naturally settle. Then, if your pain still hasn't improved by the 3-month mark, you can come back here. Question number 3. If you have a diagnosis or a working hypothesis from a doctor, physio, chiro, or other physical therapist, is your condition improving as expected after at least 6 weeks of appropriate treatment? 6 weeks is just a rough time frame because most tissue damage follows a fairly predictable pattern of healing. Physical therapy is really good at helping with injuries that respond to structural treatment. But if progress isn't happening within that window, it doesn't mean that anyone's failed, it just means that we might not be dealing with a structural issue, which is good news. Some diagnoses require urgent medical care like infection, fracture, or a tumor. Other labels can be used to describe what's been seen on scans or tests, but don't actually explain why the pain persists. What matters here is whether the diagnosis actually explains your experience and whether the treatment based on that diagnosis is helping. So this is where things can kind of overlap. You may have a genuine structural issue and a nervous system sensitivity issue, adding extra pain on top. For example, I once worked with a client who had imaging showing shoulder osteoarthritis. I wasn't going to be able to fix the arthritis. That's above my pay grade. But she had almost no movement in her shoulder, which didn't fully add up with what the scan was showing and what I was seeing in front of me. By working with her nervous system alongside the physical care, she regained about 80% of her shoulder range of motion, even though the arthritis had not changed. In cases like this, structural care and CNS-based work aren't opposites. They can actually work really well together. On the other hand, sometimes a diagnosis is assumed but isn't actually accurate. People are often given structural labels to try and explain symptoms that are being driven by CNS. This is how people can end up chasing the wrong fixes for years, spending thousands of dollars trying to repair something that was never broken in the first place. I worked with a client who had been diagnosed with TMJ dysfunction, which is an issue with the jaw, and she had actually been recommended surgery. But when I assessed her and I listened to her story, it became very clear very quickly that we weren't dealing with a jaw structure problem. We were dealing with a nervous system sensitivity problem. We didn't need to do anything aggressive. We didn't try and fix her jaw. We just worked with her nervous system. And within a few sessions, her pain reduced dramatically. She didn't need surgery, and most importantly, she understood what was driving her symptoms so that if her pain flares up again in the future, she'll know exactly what to do about it. If you answered yes to this question and you're happy with the treatment, then you're probably not watching this video. Keep going with that approach. No need to change course yet, but you can come back here if your progress stalls. And if you answered no, either you don't have a diagnosis or you're not getting the results that you would expect from the treatment to that diagnosis, move on to the next question. Alrighty, question 4. Do your neck symptoms change, move, or vary over time? One of the clearest patterns I see with nervous system driven pain is that it doesn't stay neatly in one place. This can look like pain shifting from the shoulder to the base of the skull, changing sides, or even being mirrored on both sides. It can move between different spots in the neck. It may look like your entire neck hurts one day and then just one little spot hurts the next day. Or it can show up as different symptoms on different days, like aching, tightness, tingling, headaches, rather than one consistent sensation. A lot of people describe this like they're constantly chasing the pain. I've heard this from so many of my clients and I felt it myself. Structural injuries tend to behave fairly predictably, whereas nervous system pain doesn't. If you're noticing that kind of movement or variability, move on to the next question. And if you're not sure, I'd encourage you to spend a week just paying close attention to what you feel. Many people don't realize how much their pain actually changes until they start observing it deliberately. And if your pain really is consistently in one place without variability or much variation, it may be worth spending a bit more time ruling out a structural cause before moving on. But at the same time, if you've made it this far, stick around for the next question and see if it applies to you. Question number 5. Do your neck symptoms change depending on context? Another strong indicator for CNS is that symptoms will change depending on what's going on around you or what state you're in. This might look like your neck being worse at work and better on holidays or the weekends. It might flare during periods of stress or busyness and ease when you're relaxed, distracted, or absorbed in something else. If you notice that your symptoms clearly change with context, move on to the next question. If you're not sure about this, again, spend a week paying attention to what you can feel. Contextual changes often become clearer with observation over time. Whew, okay. At this point, you've worked through the whole flowchart and you'll likely find yourself leaning towards one of three broad categories. These aren't diagnoses. I think that's right. Diagnoses. I really hope that's right, otherwise I'm just gonna sound really dumb. None of these are diagnoses. That doesn't sound right. Oh well, moving on. There's simply a way of understanding what direction makes sense to explore next. Outcome number 1. Structural causes have not been ruled out. If you answered no to the earlier questions, or you're experiencing any of the red flag symptoms that haven't been properly investigated, this does not mean that your pain is not CNS forever. It simply means that structural or medical causes need to be ruled out first. This outcome means that your priority right now should be appropriate physical investigation. This might involve seeing your GP, getting imaging if that's recommended, or working with a physical therapist to assess and treat a potential injury. Now, this doesn't mean that you can't use nervous system-based tools. Pain, no matter what's causing it, is stressful, and reducing the fear around it can be helpful regardless of the underlying cause. But the main focus should be making sure that nothing important has been missed. Once you've ruled out those structural causes, you can come back and do this flowchart again. Outcome 2, a mixed picture. If you have a diagnosis or a suspected structural issue, but your pain isn't improving as expected, you may be in what I think of as a mixed zone. This outcome does not mean that your diagnosis is wrong, exaggerated, or imagined. Structural conditions can be very real and ongoing, like arthritis is a good example. But it also doesn't mean that structure alone is fully explaining the level of pain, restriction, or persistence you're experiencing. In these cases, it's very common for the nervous system to become protective and amplify pain on top of the physical issue. So it just means that there is more than one driver contributing to how your pain behaves. For people in this category, it often makes sense to continue working with your appropriate medical or physical care while also addressing the nervous system sensitivity. These two approaches are not in conflict. In fact, they work really well together and can create very holistic care. It's also worth saying that sometimes a diagnosis is simply a best guess that doesn't fully explain why pain is persisting. In my experience, a structural diagnosis very rarely takes into account CNS, but CNS is almost always playing a role. So I personally think it's really helpful to use these tools even when you have a structural issue. Outcome number 3. CNS is likely the primary driver. If you've ruled out red flags, your pain has lasted longer than the expected healing time, there's no clear structural cause, structural diagnoses or treatments have not led to improvement and resolution, and your symptoms show patterns like variability, movement, sensitivity to stress, and context, then central nervous system sensitivity is a strong possibility. This outcome does not mean that the pain is imaginary, psychological, or all in your head. The pain is extremely real. The muscles are genuinely tight. These sensations are bloody awful. It's just that they're being driven by your nervous system. It also doesn't mean that you've failed physical therapy, or you didn't try hard enough, or you've missed something. It simply means that structural approaches may not be targeting the main driver of your pain. In this situation, continuing to chase a diagnosis or an external fix is often frustrating, expensive, and discouraging. A more helpful next step is to shift focus towards approaches that calm the nervous system, reduce threat and fear around the neck, and retrain your brain's fear responses. This is where CNS-focused approaches tend to be the most effective. If this is the path that's looking most likely for you, this is not bad news. I often tell clients that of all the problems to have in the world, central nervous system sensitivity is a good one. Not because it's easy, it's not, but because it means that the pain is not coming from something that's damaged or broken or something out of your control. It means that you have far more influence and control over your pain than you've probably ever been led to believe. And by the way, I've created a free email series called Finding Your Feet. If CNS is starting to make sense for your neck pain and you begin working with the tools on this channel or elsewhere, this series is the perfect companion. It guides you through the twists and turns of the CNS journey so that when your symptoms fluctuate or doubt creeps in or progress isn't linear, you know what's normal and how to respond. You'll find the link in the description below. Quick note, across all three outcomes, there is room for overlap. You don't have to pick a camp or stop seeing a practitioner that you trust because you're exploring different perspectives. The goal here is not to stop things that are helpful. The goal is just to give you permission to stop doing the things that aren't helpful and start moving in a direction that actually matches how your pain behaves. So this video wasn't about fixing anything. It's more about wrapping your head around where you're at and getting a clearer idea of what kind of neck pain you're likely dealing with, so that you're not throwing treatments at the wall and just hoping something sticks. If, as you've gone through this, you find yourself leaning towards central nervous system sensitivity or sitting somewhere in that mixed zone, then the next question that usually comes up is, what do I actually do about it? That's what the next video is all about. In the next video, I'm going to introduce you to something called the 6 Fs. It's a simple way to start breaking down the nervous system patterns that keep us stuck in pain. If this video helped things click into place, then the next video is the natural next step. See you there. Bye.